unaenda kuuza huko na tusianze hii shortcuts hivi. We are thinking we are making a shilling here, making a shilling there, when in actual fact you are exposing yourself first, your family and the rest of the community. Tufuate sheria vile tumeelezwa. We will keep working together jointly and ensure that we succeed. Lastly, the message that our president gives us all the time: we are family. This is a time to come close together. Tuungane sisi wote. We are as strong as we will work together. Hii ni shida yetu. It's time for us to speak to one another, to look out for each other. Those of us who are able bit, tusaidie wale ambao hawajiwezi. And then we take care of the vulnerable people in our midst. The government will not do everything. But because we have always lived as one family called Kenya, let us try to help our people and help each other and ensure that we keep safe. And by the grace of God, we will cross this bridge. My last request to all of you, our people, let us pray for our leaders who are leading us in this war. Tafadhali tumuombee rais wetu. If you look around the world, how countries have fared in this matter depends on the way they have been led. Our president has stepped up to this mandate spectacularly, and he has led. Tumuombee rais wetu, so that the Lord may strengthen him as he leads us in this. Let us pray for my brother Mutahi Kagwe, the Minister for Health. This is a tough time to be Minister for Health, honestly, very tough. And all of these, my sisters and brothers, you see here in uniform, the health workers, tuwaombee Mwenyezi Mungu awaonee huruma na awabariki, so that the Lord strengthens them, because it's not just about salary. They are also making sacrifices to keep us healthy and to keep us safe. So tuombeane zote wakati huu, and let us go before the Lord all the time with humility, and hope that the Lord will see us through this challenge, even as we do the best we can, as we are told by our leaders, to ensure that we keep safe and we keep secure. With those words, it's my distinct honor and privilege to welcome my very own brother, my friend, our colleague, and our Minister for Health, the Honorable Mutahi Kagwe, to speak to us and speak to the nation.
Thank you.
Here.
Thank you. Thank you. Thank you very much, my brother, CS Matiang'i. Your Excellency, Governor of Kisii, Your Excellency, Governor of Kakamega, my colleague and good friend, Secretary for Interior and National Government Coordination, Honorable Fred Matiang'i, the leaders of the Kisii County Government, executives here present, the members of Parliament, the women representatives who are here, the senators present, members of the Kisii County Assembly here present, ladies and gentlemen. Welcome to our daily COVID-19 briefing. Today, we are very proud visitors of this great county of Kisii. Your Excellency, Governor, I wish to thank you and the great people of this county for your very warm welcome and hospitality. Our visit to this county is part of a series of visits intended to assess the preparedness of counties to fight the COVID-19 pandemic, as well as engage with the county administration and county government on matters health and what we together can achieve. Our visit today, Your Excellency Governor, is also a hallmark, because today we are in a county that demonstrates very clearly the advantages of devolution and the wisdom that our fathers and those of us present who created the 2010 Constitution can be very, very proud of. What we have seen here would probably not be possible had we not had devolution. Fellow Kenyans, it has been 5 months since the first COVID-19 case was confirmed in the country. You will recall that at that time, our country was not well prepared to fight the pandemic. The national and county governments lacked adequate facilities, including isolation centers, ICU beds, and enough personnel to assist in the fight against the pandemic. We took immediate measures to address the shortfalls But key among this was the need to have enough capacity to deal with these cases at the county level. This was important because each county has and will continue to face unique challenges relating to COVID-19. As the cases continue to increase across the country, it will no longer be possible to refer cases away from our respective counties. We must have the capacity to manage such cases. I am happy to note that Kisii County handled the case, as you have said, Governor, of the late nurse, Mariam Owol Adumba, effectively. You did so with admirable efficiency and effectiveness. Indeed, even if it was a referral from another county. Even as we appreciate Kisii, moving forward, cases such as the Marian one should be handled in counties where they are confirmed. Counties should have the capacities of handling their own COVID-19 cases. And on that note, I wish to again condole the family of Marian, and indeed may the Lord rest her soul in peace. Indeed, the third extraordinary session of the National and County Governments Coordination Summit held on the 19th of June, co-chaired by His Excellency President Uhuru Kenyatta and the Kakamega Governor Wycliffe Oparanya, set out the target of 300 isolation beds for each county to enable the handling of our infections. I know for some counties, this seemed like a dream, given that many there had no cases or had no confirmed cases. As we stand here today, each of our 47 counties has now reported confirmed 19 cases, COVID-19 cases. This means that the level of preparedness remains a key objective to all county governments and indeed the Ministry of Health. Fellow Kenyans, in a statement issued by the Council of Governors on the 15th of July, it was reported that cumulatively all counties had set aside 271 isolation health facilities for COVID-19 patients. I'm certain that the number has since grown tremendously, and I'm particularly glad to note that Kisii has planned 5 isolation facilities with a planned 386 beds, not to mention the ones you have already mentioned, Governor. And further, you have just told us that the county has tested some 2,000, has sensitized 2,281 health workers on COVID-19. 400 of those people have been trained on infection prevention, control, and contact tracing. More needs to be done, and my ministry will work with your government to see which areas require further support to ensure that our health workers remain safe and on top form to handle the deadly virus or any other infectious diseases that come and to face us. You have also said, Governor, that you have now got 41 cases out of a sample size of about 2,500, and 5 were just today. The level of infection can be managed through contact tracing, and I urge Your Excellency to keep up the good work that you are already doing here. Despite the seemingly low numbers in your county, you have managed to increase the capacity that you have just told us at the Kisii Teaching and Referral Hospital. Out of these, 15 are ICU beds in that facility with ventilators, and you have just told me that you're adding another 7, which will help a lot if indeed you are to be faced with ICU cases. This is impressive. I must also note that there is a 400-bed quarantine facility here at the KMTC, and I want to thank the board of KMTC for really being extremely helpful as far as quarantining and isolation facilities are concerned. In addition to that, of course, is Kisii High School, which also, and I want to again to thank the board for facilitating us and giving that facility for isolation and quarantine facilities. Governor, nimekupa hongera kwa ile kazi mzuri unafanya, na hiyo kazi inasaidia Wakenya, sio watu wa Kisii peke yao, ni Wakenya wote ambao watafaidika na hiyo kazi unafanya. Fellow Kenyans, even as we work hard to fight this pandemic, we should not forget that other health challenges continue to face us. One of those is cancer. And again, Your Excellency, I'm delighted to see the effort that you are putting in terms of establishment of the Kisii Cancer Center. I am delighted that you are going to build this hospital here. I'm delighted that it is to the tune and capacity that you have just said. And as these cancer centers continue to grow across the country, it will be to the benefit not only of our people in the counties that we serve and we belong to, but also for all Kenyans. And this is going to assist us not only to treat Kenyans, but also in our effort to make our country a medical tourism center. As we celebrate these many achievements, we take note that here in Kisii, as indeed the case in many of our other counties across the country, patients are scared. They are getting scared of coming to health facilities because they believe that they will get infected with COVID-19. Further, that COVID-19 patients are being stigmatized and discriminated against, hence the fear to visit health facilities. May I just say this, that our health facilities across the country are open to handle other cases besides COVID-19, and we continue to encourage Kenyans to take advantage of our health services. Msiogope jameni. In all our facilities, we have taken measures not to mix the COVID-19 cases with other patients. We learned this example from Italy, where because of mixing COVID cases with other hospitalized people, the rate of death was very, very, very high. So we want to make sure, and we have just observed here in this hospital, that the COVID-19 facilities are very separate from the other facilities. So I want to congratulate you, Governor, for that effort, for keeping the separation clear and also the treatments clear. So let's not fear, msiogope. Endeni hospitali, ukiwa una ugonjwa, nenda hospitali, usikae nyumbani, kwa sababu ukikaa nyumbani, unaweza kwenda na safari hiyo, uende na hiyo ugonjwa ingine. You know, it is not COVID-19 only that kills people. All these other diseases kill us as well. So please, let's make sure that we do so. And as we do so, we also know that in an area like this, Governor, people are not hungry. Hapa tunajua, we enjoy our matoke. We like our traditional foods here, and I can attest that because I occasionally visit my brother here, and I know that matoke is part. Sweet potato, beans, ugali, hiyo ndio mali tunakula hapa Kisii. Na hiyo ni mzuri, because part of fighting the disease is increasing your immunity. And healthy eating is part of the ways of ensuring that we do not get the infection. But as we enjoy these foods, please remember also that eating unprocessed foods is better than eating processed ones. Vegetables, fruits, these are the things that have been advised by our doctors, are the things that can keep away this disease. Failure to do this could lead to a high incidence of the non-communicable diseases. This is why I urge you not to fail to visit health facilities and manage your health better, but also eat better if you can. Remember that when you are generally healthy, you will get away with a lot of conditions that you otherwise would not. Fellow Kenyans, I think C.S. Matiang'i has put it very aptly, that save yourself. The first thing to do is to save yourself. And to save yourself is to follow the guidelines that we have given, including social distancing. You can see right here how your leaders are standing. This is the way to do it. They are not doing it for fun. They are doing it because that is what is necessary for us to live literally, to save our own lives. And therefore, I want to urge you to adopt this motto, that you save yourself, but you save me, then I can save you. And it is important to note, and I've said this before, and I'll keep repeating it, no matter how boring it is, and no matter how many times we repeat this, we must do it. Because I have said, while the figures may be boring, the most boring thing you can have is staring at the ceiling on a hospital bed. That's a lot more boring. So do not waste yourself to get there and to get that vote. Turning to our COVID-19 statistics today, from our sample size tested in the last 24 hours of 6,814 people, we have now reported today 727 positive cases. And I've just said 5 of those are here in Kisii. The total number now of cumulative cases is 25,138. 711 are Kenyan people, while 16 are foreigners. Men continue the lead with 539 men against 188 females. We must honestly ask ourselves as men, what is going on? How can it be that almost 540 of us, against less than 200 women, have gotten this virus in the last 24 hours only? And therefore, we need to address it. I think you will find that in terms of care, in terms of using masks, in terms of social distancing, women are just being that much more careful. And I know there might be some macho-ness, kuwa mungwana, kuwa mtu mkali, uonyeshe una nguvu, wewe huwezi kuvaa mask. Mimi ni fellow. Wewe ni fellow, mkali sana. If it was in the Wild West, you'd be slinging guns. You will die. Utakufa na hiyo ufelo yako. Hiyo ufelo hakuna pahali itakupeleka jameni. Hiyo ufelo macho. This is a virus. It knows no macho-ness. It is not something you are going to get a gun and fire against. And it is not something you are going to get a simian cut. This is something that will be inside you. And it will kill you. So please, I beg our men, me included, my colleague here included. I know that Mheshimiwa Senator is a doctor, so he doesn't joke around with the disease. But really, as men, we need to be a lot more careful than we are. And our behavior pattern is not helping us. Nairobi, I have said before, we are particularly concerned with almost 400 cases now, 393 cases today. Why in Nairobi? We have kept on asking our colleagues, people from this area who live in Nairobi, people from Kisii who live in Nairobi, we would like you to stay there. Stay in Nairobi, please. Hapana kuja Kisii kwa wakati huu. Ama namna gani jameni? Kwa wakati huu kaeni Nairobi, hii virusi ikikwamishwa, basi mnaweza kuja. Na si semi ati kila mtu asije, ama la sivyo ndugu yangu hapa ataniuliza sasa unasema mimi nisije hapa Kisii. Hapana, lakini ukija Kisii fanya vile amesema na vile anafanya. Amevaa mask na yeye ana keep social distancing. So please, those people who are in Nairobi, if you don't have to come here, don't come here. If you have to come here, please be very, very careful. Because the trend that we have seen is a lot of infections are actually being caused by people coming from Nairobi and bringing it. Even though there is community spread at the moment, but nonetheless, we would like to urge. But today, I am also delighted to inform you that 674 patients have recovered from the disease. From this number, 125 people are from home-based care programs, while 549 have been discharged from various hospitals, bringing the total number of discharged persons to 118. Our congratulations once again to our health workers. This is their effort. This is even those who are in home care are still being observed by our community health workers. And therefore, I want to thank you very, very, very much. Unfortunately, we have also today lost 14 patients. And therefore, the total number of fatalities to date in this country is some 413 people. That's a lot of people, my friends. Let's pray and hope that this number is not going to grow, is not going to keep on going up, but instead we will stay at the levels that it is. My sincere condolences to the families and friends of those who have lost their loved ones. Tukitoka huko Nairobi. Sorry. Yeah, thank you. Tukitoka huko Nairobi, sikuja peke yangu hapa, tulikuja na pia wenzangu wachache kutoka the Ministry of Health. Yule wa kwanza tulikuwa nakuja na yeye leo alikuwa my PS ambayo ni wa area hii, Susan Mochache, si unamjua? Amemsalimia, mmesalimika? Vile vile we came here with Edan Talam. Edan Talam, the CEO of the Nursing Council of Kenya. Where is she? Oh, she is here. Mpigeni makofi tafadhali. Mambo, and I know the nurses know her because she is the CEO of the Nursing Council of Kenya. Vile tuko na Susan Koki Mutwa. Where is Susan? Are you around, Susan? Yeah, Susan Koki Mutwa. That lady there is head of public health, the head of the public health department. Then we are here with Dr. Wafa Osman. Yeah, Dr. Wafa Osman is here particularly because of the COVID testing center that we are talking about, the one we have just come from having a look at the labs and facilities that you have, and we want to create Kisii also as one of the COVID testing centers. The problem we have been experiencing and the reason why we have not been testing here is because of the lack of reagents for the machines that are here in this county, and we are trying to make everything possible so that we can start testing here. We know that the demand is huge, and the idea of going all the way to Kisumu, taking samples there, I know that is a big challenge. So we are trying to place as many centers as possible, possibly one here, one in Kakamega, and then so that people can have faster ways to visit. In addition to that, to those people, of course, is Dr. Amath, who I'm sure you'll see here because he might have to answer some of the questions that are going to be asked by the members of the Fourth Estate. And while at it, I also want to thank very sincerely the members of the press, the members of the Fourth Estate, for the continued education you have continued to carry in terms of COVID-19. And as Governor Oparanya has said, wherever there are issues, we will deal with them. I can tell you for a fact that the Ministry of Health is going to ensure that every single cent that is given by the government is spent to ensure that there is support in COVID-19, for COVID-19 only, and no other way. But I think it's also important to remember that the effort of COVID-19 is not a Ministry of Health domain as such. It is both the ministry as the national government, it is the county governments, it is also other sectors of the government, including the money that we are supporting vulnerable families. The CS Matiang'i has just talked about 20,000 who are here. We continue to support families. We continue to send money every week to very vulnerable groups that are in Nairobi, in the densely populated areas. So it's a holistic approach. It is not a one ministry approach system. So I would like to stop there and thank everybody for your hospitality once again, and now take one or two questions before we call it a day. Questions? Yes.
My name is Laura. I work with Citizen TV. The first question is, considering how Tanzania has been a bit non-compliant with the WHO protocols, why is it that it is exempted from the list of those who will be put on mandatory quarantine? The next question is concerning healthy eating. There has been a narrative going around that consuming lemons and ginger is somewhat preventive to COVID-19, and some are even saying it's curative. So is there any scientific basis to this theory?
Any other question?
Question number 2.
My name is Eric Abuga, with the Standard newspaper. According to Professor Ongeri, what he has said in regard with what Professor Ongeri has said with the expectant medics, is it a government policy that these people will be given a sick leave, maybe, or a leave, paid leave?
Any other?
This one?
Yes, please. Introduce yourself.
Thank you very much. My name is Abraham. I am an analytical chemist, and I would just like to I'm not a media person. I'm just a resident of Kisii. I would like to seek assistance from the Ministry of Health for my concept paper that I've been trying to reach you out from Patrick Amoth, which I really appreciate the department that has given me some response. But since then, I'd like to give one thing based on microecological intervention.
Thank you very much, Abraham. We will, Mr. Dr. Amoth is right here, so you are very lucky today. You can see him macho kwa macho. Na umpatia ile unataka kumpatia. Let me just, I'll yield the questions on health issues to Dr. Amoth. But as far as our system of quarantining or not quarantining countries around us, we do not deal on country to country basis. We deal on it on the basis of that the fact is that everybody coming into Kenya, irrespective of which country they come from, must come with a COVID-19 negative test. And we have given that allowance. We have got an East African protocol that involves Tanzania before. And I can tell you that originally the problems that we had was some countries insisting on no testing because they are saying there is no COVID, therefore no testing. But nobody can come here without a test. So irrespective of internal policies in the different countries, they can follow the policies that they deem fit. But as far as testing is concerned, you must have a COVID-19 test, irrespective. Otherwise, you will be quarantined for 14 days. It doesn't matter where you are coming from. I would like to ask Dr. Amoth to respond to the issue of expectant medics. There are 2 medics here also. The senator is also a medic. So let me ask the younger one to reply in this particular case.
Thank you, Waziri, Excellency Governors, elected leaders. Regarding the question of Tanzanians, to add on to what Waziri has said, is that on 30th of last month, WHO issued guidelines on how to resume international air travel. And these guidelines are based on the pattern of transmission of the disease, COVID-19. And if you look at that classification, Kenya and Tanzania were classified in one group as a high-risk group. That is where there's established community transmission. And therefore, somebody departing from a country with community transmission and arriving in a country where there is community transmission, there is not much difference in terms of epidemiological trends of COVID-19. That is another basis on which we allowed Tanzania, as our sister country, to be able to come in, but with a COVID test, as Waziri has said. Looking at even the figures, remember, we've even allowed people from the United States, which is reporting higher cases of community transmission. But it's because we are in the same criteria of classification that we allowed them to come in. Not forgetting that we have put into place proper measures at our ports of entry to ensure that we prevent importation of cases. Ginger, lemon, honey, again, good because those are sources of vitamins and micronutrients. But the message to take home from today is that there's still no cure for COVID. I will not stop taking your ginger, your honey, or your lemon as many times as you want. That for sure is not a treatment or a cure for COVID. Regarding healthcare workers, including the pregnant women, pregnancy is included as one of the conditions in which you have depressed immunity, because a pregnant mother carries a baby who has a 50% genetic constitution from the father and 50% from the mother. So pregnant women are at a higher risk of getting a severe form of COVID-19. And it is on that basis that the ministry issued guidelines that pregnant mothers are exempted from working in COVID-19 isolation and quarantine centers. I thank you.
Thank you very much. That will be all from me. I now hand it over to Governor Ogoe so that we can close it. I want to thank you once again, Asanteni Sana.
Thank you very much, CS for Health. Thank you very much, CS for Interior. My brothers and sisters, tuwapigie ma-CS makofi. Tutakuwa na treatment center ametuambia, and many other things that I asked him in Marani, and that I've also asked him here informally because there was no time for me to say them. CS Interior, I have had a very good working relationship with the County Commissioner, Mr. Kiara, with the County Commander of Police, Mr. Jebel. These are two very, very, very good people, and I have enjoyed working with them in the coordination as we co-chair the management of COVID in this county together with national government. For the members of Parliament and members of the County Assembly, we please, if you can be able to go to Fanisi so that you can have your lunch there. I thank you very much, ladies and gentlemen. I thank you very much, CSS, and be blessed. Thank you very much.
One more thing.
To receive breaking news alerts, SMS the word news to